Now, there are those on the left who believe that the only way to fix the system is through a single-payer system like Canada's, where we would severely restrict the private insurance market and have the government provide coverage for everybody.
Overcrowded emergency rooms, a problem in too many hospitals. In that regard, Nova Scotia is no exception.
An ambulance is en route to the Valley Regional Hospital. A man has been injured in a backhoe accident.
2 or 3 minutes? Yeah.
There's a scramble to find space in the already overcrowded emergency room, and a rumor of another accident, a car accident. Overcrowded emergency rooms. It's an issue in both small and large hospitals.
The emergency department is in crisis.
These nurses, X-ray technicians, and ambulance workers were the first to go public with their frustrations. They work here at the Queen Elizabeth II Health Sciences Centre, in the largest emergency room in the Maritimes.
But when you have 11 patients and you're only supposed to have 3, things will happen. Medicines will be missed.
Waiting lines of up to 16 hours, stretchers in halls. The emergency room so backed up, healthcare workers say patients are suffering unnecessarily.
Doing that, then the money that they are spending on health care is money that otherwise could have gone to job creation. What I want to do is just make brief remarks on the front end.
Welcome to Obamacare, a room full of politicians tinkering with the entire healthcare sector of the United States. This American hospital is on the front lines of the battle between doctors and politicians, between individuals and the state, between freedom and force. I'm Logan Darrow Clements, and I'm going to take you just north of our border, where politicians have gained the upper hand in this battle. America's healthcare sector is sick, but will Obamacare cure us or make us sicker? Canadians know the answer. If we follow their story, we'll discover the terminal destination of Obamacare. Canadian politicians didn't mess around. They simply outlawed private health insurance and took over.
And his name was Tommy Douglas. And in 1944, he came up with the idea of universal health care, a single payer, got rid of all this notion of having insurance companies involved in health care.
If I am a citizen and I want to buy health insurance and somebody wants to sell it, you believe it's right for the government to step between us and say, no, you two shall not trade.
Not only do I believe that, most Canadians believe that.
So you believe each person has a right to health care?
Absolutely. Yeah, quality health care, though.
Let's take a look at some of that government quality health care. I know it must be good because Canadians are always waiting for it. Here's what Americans can expect with Obamacare, or as Barack would say,
now let me tell you what change looks like.
So we end up having to just go to the walk-ins and wait hours and hours and hours, and you never know who you're going to get.
So you can't get a family doctor?
I cannot get a family doctor.
And there are studies done that, almost 80% of family doctors in Ontario are not taking on new patients. And I pay my secretary an hour a day just to handle calls from people begging to get into my practice, explaining to them what's going on, who they can speak to, but it's very difficult for the patients.
If you're not satisfied with the treatment that you're getting from your family doctor, you have a hard time getting another family doctor because there's such a shortage of doctors to start with.
When I go down to the cancer clinic and you find almost standing room only people waiting, there's something wrong with the system like that.
I used to work in a remote area for 5 years, and I remember that when a doctor came to open a new cabinet, there was already people waiting in line the same day he arrived. And in 3 hours, he would fill up his list of patients for the rest of his life if he wanted to.
We're one HMO that services the whole province.
Why is it so important to have a family doctor? Well, if you've got a serious illness, you probably need to see a specialist. But you're not allowed to see a specialist without a referral from a family doctor. According to the Canadian government, 4.1 million Canadians don't have a family doctor. I wonder how that happened.
happened. And I remember in the Ontario government in the early 90s specifically decided that the problem was too many doctors.
This group of bureaucrats get together and say, well, how do we decrease the number of doctors? Well, first of all, the first step would be to decrease the number of medical school spots.
And they started paying the University of Toronto not to graduate doctors. The size of them went out.
The second step is to decrease the number of doctors already present. They paid doctors $500,000 just to close up their practices.
Provincial government retired hundreds and hundreds of doctors, nurses, technologists, so that they would decrease their budget costs. And this created a hell of a problem in Quebec.
And their theory was if we have fewer doctors, it will cost us less money. And we tried to point out to them that the costs weren't generated by the physicians, they were generated more by the patient demands.
And the medical schools at the time said, if you do this is the early 90s, said if you do this in 10 to 15 years, well 15 years, you will have a huge doctor shortage. It only took about 10. Because now we have millions of Canadians who have no doctor.
If you like your doctor, you can keep your doctor. In fact, we're taking steps to increase the number of primary care physicians so that seniors get the care that they need.
Just in radiology, we went from 540 radiologists to 470. We lost 70 radiologists in 1 year. And we were already short, okay? And that's only in radiology. You can take this to every other specialty. Same thing for the nurses.
I love nurses. I love nurses.
We lost our senior nurses in the OR room.
And they will testify I loved nurses before I got to Washington.
There are approximately 300,000 people living in Montreal without a family doctor, but the province of Quebec will only allow how many new doctors in Montreal?
4 to 5.
They deliberately created, and the irony is the people who masterminded this popped up years later as the people who were going to fix the problem that we didn't have enough doctors.
But the problem is our population in Montreal grows by 15,000 every year. And you need 7 or 8 family doctors to treat that population. So, you know, this is not working.
If you like your doctor, you will be able to keep your doctor. In fact, more people will keep their doctors because your coverage will be more secure and more stable than it was before I signed this legislation.
Waiting times are how a publicly funded, open-ended system works. In other words, and the Supreme Court of Canada, hardly right-wingers, have said that when you have, in theory, an almost unlimited demand, you have to limit the supply somehow. And the ways our system limits it is by not giving people timely care.
There are now websites built in provinces by their medical departments of health, that allow people to go and check out what their wait list time is for a medical procedure.
Look it up for yourself, or go to any credible news outlet's website and look in terms of what reform will mean for you.
The total number of medical procedures for which Canadians were waiting in 2009 was 694,161. This stadium holds around 67,000 people. If each person was waiting for only one procedure, then imagine more than 10 stadiums, each packed with 67,000 sick Canadians waiting weeks, months, or years for medical treatment. If the U.S. got similar results with Obamacare, we would have over 95 stadiums filled with Americans waiting for treatment. That's over 6,393,000 people stuck waiting for a government bureaucrat to grant them care. The Department of Motor Vehicles will be fun compared to this.
Beginning next year, preventive care, including annual physicals, wellness exams, and tests like mammograms, will be free for seniors as well. That'll make it easier for folks to stay healthy, but will also mean the doctors can catch things earlier, so treatment may be less invasive and less expensive.
And you have to wait for 2 months for this one, another 2 months for the other one, and another 3 months for the other one. And in the meantime, You're just left wondering what is wrong. You know there's something wrong, but you don't know what is wrong.
I run a support group. We have young people now in the group. A 40-year-old who had been having symptoms since she was 25. And the doctor just said, oh, it's just nerves. But you know what? The symptoms are there. They should be tested.
A lot of the procedures take a long time. MRIs could take up a year, 2 years to get one. By then, who knows? You could be in so much pain, might not be able to ever walk to get to the MRI.
Okay, so you were around the middle of January, and they couldn't get an MRI scan to see if you had brain cancer or not until the end of May.
Correct. They are only allowed to do so many per week.
Who prohibits them from doing more MRIs each week?
Government.
I think radiology is probably the most important science for treatment because radiology is at the heart of diagnosis.
We do not have a CAT scanner, which is pretty much standard of care now for most places, but we don't have one here.
We definitely need more PET scans all over Quebec. And these are the latest technology to detect small tumors. So these machines are definitely in shortage in Quebec and Ontario.
The PET scanner, for example, is the latest type of scanning technology. It allows doctors to diagnose and detect metabolic cancer a year earlier than with the older scanning technology.
If they had better imaging at that time, such as a PET scan, they would not have opened me up, they would have saved money, and they would have saved me a lot of pain and aggravation.
PET scan would have been very helpful, but the Ontario government doesn't hand out very many free PET scans. So the doctor didn't even bother to write the Ministry of Health because he knew what the answer was going to be, no.
What people don't know is that hospitals may have an MRI, but it doesn't mean that this MR is functional 24 hours a day like the States. The budget cuts will make it that most of the hospitals, the MR will function from 8 in the morning to 4 in the afternoon.
So these scans are sitting empty, or else they're doing testing on animals.
My daughter had 2 Dalmatians. They both developed spinal problems. And she took them both for MRIs in London. And the MRI machine that they used was at the hospital that they use for people. But they use it after hours for pets. And she didn't have to wait very long before she got the MRI for either one of her dogs. Whereas with people, you usually have to wait a long time to get in to get an MRI.
So he says, you're going to have a colonoscopy, and he phoned the hospital to arrange for one. This was in June, and he phoned back and says, you can't have one till November, they're all booked up. And I thought, June, July, August, 6 months. I says, the cancer's going to, if I have cancer, which I suspect, it's going to really travel.
And insurance companies will be required to cover, with no extra charge, routine checkups and preventive care, like mammograms and colonoscopies, because there's no reason we shouldn't be catching diseases like breast cancer and colon cancer before they get worse.
So April, May, June, July, 4 months.
So 4 months, and all this time the cancer is progressing.
It spread to my liver. It got worse in my lungs. Basically it was progressing, and it didn't look very good for me.
It's the only way I saved 5 months by going to the emergency ward on my own.
And what did they find?
That I had cancer in my colon, and they removed about 12 inches of it. And at that time, they found that it had gone a little bit into the liver at the same time.
So just to give you an idea, my drug had to progress for 4 months before they said, yes, John's definitely progressing, his cancer spreading, it's getting worse. Now we're going to send him for out-of-country coverage. I had to actually have 2 drugs here that did not work before they were going to be able to send me to Buffalo in Amherst to get a drug that does work.
I did go down to North Carolina. I spoke to a doctor down there. He says, we can do this in 3 days. That you have to wait here to try and get into Montreal that has the procedure, they're trying it. You have to wait here for over 8 weeks just to start it. So certainly if I had the insurance in the States, I'd be down there and I would have had the procedure already months ago.
The Canadian system is very lethargic. They're not very aggressive. They don't go after cancer aggressively. So I've read and so I've experienced.
Well, the time that I had to wait, all the time that that I had to wait, the cancer kept spreading in other places. So I ended up with cancer in 3 different places. Instead of having it just in one, it spread to 3 different places.
It took them 6 months really to do anything about it, and by the time I was ready to have an operation, the cancer had further metastasized into my liver.
It took 13 months to diagnose and for me to have surgery for my cancer. And for my dog, it was done the next day.
People suffer, and there seems to be this idea that it's okay if people live with pain as long as we don't spend, excessive money on the system.
My basic problem began as a degenerative disc disease, which is a collapsing of the vertebrae. I've been in constant 24-hour pain for many years now, and I asked for an appointment. I got a phone call saying that that appointment was going to be in November. This was in October. I was excited that it was going to happen so quickly, but then they told me it was actually in November of the following year. This level of extreme pain that I'm in all the time has severely affected my life on every level, from not being able to work to not being able to leave the house for more than 2 or 3 hours at a time. This neuromodulation therapy that we were talking about is at this point not available to me in Canada.
The longer you have to wait, the more stress there is. And we're not addressing that in any way, in any significant way at all.
We were moving a big server cabinet for a company downtown. My foot slipped and it came down on top of me. With this injury, as time goes by, it gets worse and worse. I can't sit down for a long period of time. I can't lay down. I haven't had a decent sleep since it happened. Oh, we're going on, 7 months now? Somewhere around there. 7 months of this pain. Could be a year before I even get fixed.
We have a client now, however, with debilitating spinal problems, that there are times the pain is so severe that when he goes from one room to the other in his home, he has to crawl on the floor. There's no way he can walk. The pain is so severe. And yet, this gentleman is not even on a waiting list. His family doctor in Nanaimo, British Columbia, cannot even get him seen in consultation by a neurosurgeon.
Mark Capon was the life of the party. He stayed in shape playing baseball, hockey, and raising 3 kids with his wife. Mark's brother Bruce, a doctor, and Mark's wife Diane have seen firsthand what waiting lists mean. Defenders of the healthcare system as it is now in Canada, when you mention wait lists to them, they'll say, well, wait lists are just an inconvenience.
Well, in that case, you could say that my brother suffered an inconvenient death in that case.
I would have thought his doctor would have signed him in like right then and there, like taken him in and said, we've got to take a look at this.
How long did Mark have to wait?
He waited. He was on a list just for the angiogram part for 30 days, and he died within a week after being put on the list.
In the movie Sicko, Michael Moore visits his Canadian relatives. Well, I have Canadian relatives also. Actually, I have one less Canadian relative. He died while seeking a treatment that the government refused to offer. And what did the doctor diagnose Don as having?
Chronic lymphoma leukemia.
From the time he was first diagnosed with leukemia, how much later did the chemo start?
Maybe 5 years.
Why didn't they start the chemo or do some sort of operation right soon after they discovered the leukemia?
I don't know why. I guess because it wasn't, the blood count wasn't high enough. It had to reach a certain level before they started treating it.
His doctor wanted him to get a certain treatment for his cancer, and his doctor applied to the government cancer bureau to request this treatment. And did they give it to him or not?
No. They said it'd be 6 weeks, and he didn't hear anything in 6 weeks, so he called a couple of times to his doctor's office, and they didn't get back to him. The blood count was really high. It was way above what it should have been.
The white blood cell count.
Yeah. And so the doctor's office called him and said, get in here right away, and gave him an appointment. So we went in, and at that point, they told him that they wouldn't okay the treatment. The council board wouldn't let him have it, and they put him on radiation treatments.
Do you think the cost of the treatment might have had something to do with it?
They said it was because they didn't use it for that particular thing, but his doctor thought it might help him, so.
So it's sort of the doctor versus the bureaucrats.
That's about it. They have to make hard decisions when there's only so much money to go around.
And I will make sure that no government bureaucrat or insurance company bureaucrat gets between you and the care that you need.
But he thought that the price of the drug was too expensive to prolong my life.
Under this plan, it will be against the law for insurance companies to deny you coverage because of a pre-existing condition.
They tell you, oh, you're too old, or you're too young, or they've always got an excuse.
It takes Health Canada 2.5 to 3 years to approve a drug. So then the provinces, and I don't know, our province says, well, we're going to test it too, so we're going to look another 2 years before we approve the drug. We've lost 5 years here.
And a lot of Canadians may have died in those 5 years.
Exactly.
If you hadn't gone outside of Canada to get the Erbitux, what would have happened?
He probably would have died.
They make people for hip surgery and knee surgery wait sometimes years. Cancer patients don't have that option. The oncologist referred me to the surgeon. He suggested a process called radio frequency ablation. In the rejection letter, whole hip, basically, they said it was experimental and it was not an accepted procedure. They make it so ambiguous that it's a catch-all phrase. And if it's something that they don't wish to cover, then it's covered by experimental. We went to the appeal board hearing. The board ruled in my favor. They found that the procedure was not experimental. My biggest fear after the whole thing was that they would reappeal.
As soon as I sign this bill, it will be against the law for insurance companies to drop your coverage when you get sick or water it down when you need it the most.
They have been known to do this in the past in other cases. They will spend more on the legal fees and lawyers than what the original claim was. That's everything I had, everything I've collected in my fight with OHIP.
The best example is the claim made not just by radio and cable talk show hosts, but by prominent politicians, that we plan to set up panels of bureaucrats with the power to kill off senior citizens.
Well, shots rang out in a hospital emergency room in Toronto as the new year began. They were fired by police at a man who had brought in a sick baby and demanded immediate attention. When he didn't get it, he pulled a gun and took a doctor hostage.
But he wanted immediate attention for the child. He then took one of the emergency doctors hostage. 3 shots were heard by witnesses, and the man was pronounced dead at 12:20 in the morning by medical authorities. The doctor wasn't hurt, and there were no other injuries.
I think what happens when any system starts to collapse, and when we already see it, overwhelmed emergency wards.
One of the complaints about the U.S. healthcare system, a legitimate complaint, is that too many low-income people have to go to hospital emergency rooms to get their care. What the critics often overlook is that the same thing happens in Canada, the same thing happens in Britain.
Ambulance drivers will get a patient to a hospital, and then there's nowhere to put them.
The emergencies are swamped. Then when we do have patients come in with a fractured hip, they may wait 3 days in our emergency before they get up to the OR.
You'll have periods where there are frighteningly few ambulances covering all of Toronto. It is terrifying.
Our military in Afghanistan was criticized for torturing their captives by putting them on a stretcher in a brightly lit room for 24 hours straight. Well, we put them in a brightly lit hallway for 48 hours straight, 72 hours straight, and they have a very painful right hip because it's broken.
There are cases of relatively rare where people come in to emerge and wait so long that they die.
Apparently, Charlie had been here out in the workshop using a side grinder, and his clothes had become ignited and caught fire. He had third-degree burns, and at that point we met Dr. Gibson, who is the anesthesist up here.
They were third-degree burns, roughly 30% of his body. It was the left side of his chest, left side of his back, his whole left arm, left face, left neck. We had called Critical and asked them to try and find us a burn unit, and they'd been in touch with all of the ones in Ontario and said there are no burn beds available anywhere in the province. The plane arrived at 10:30, and then we finally got loaded in the plane and took off for a short flight across the lake to Rochester. And he arrived at the hospital there around 11:30 that night. We're getting ready to do skin grafts on him the following day, and the Ontario Ministry of Health phoned and said, no, wait, we want him back in Ontario now. We have our staffing issues settled. We'd like him back in Sunnybrook Hospital in Toronto. And the staff in Rochester apparently said, look, he's way too unstable to be shipping back at this stage. We'd like to start with the skin grafts, and the word was, no, don't do that. We'll do that when he comes back. And it was about 4 days later before the transfer was actually possible to get him back to Ontario.
When Charlie was at Rochester Strong Memorial, I have out-of-country coverage through my employer. I was told that the Ontario health system, as the first payee, has the right to decide where the treatment's going to be. And they had insisted that he be returned to Ontario for his skin grafts.
The ventilator was not functioning on the helicopter for the trip back. And eventually the hospital in Rochester loaned them a ventilator to use for the trip back to Toronto.
We've got an overloaded bureaucratic system that is just choking our real healthcare system.
He arrived here in our hospital at 3:15 in the afternoon. He got to a burn unit at about 11:30 that night, and the skin grafts were 4 days later.
I'm extremely frustrated with the healthcare system. I feel that it's pretty sad when the system itself is more important than the patient.
They always talk about the golden hour with any kind of trauma, that you want to get going with the treatment in that first hour if you possibly can. And, we can spend hours on the phone sometime phoning different places saying, have you got a bed for this kind of patient? And the answer is no.
I really think that Charlie's delay in the skin graft issue, or delay before it was started, was a matter of economics. I think the bureaucrats didn't feel that they wanted to, whether they thought it looked bad that he had to go to Strong Memorial, or whether I think it came down to dollars and cents.
Your cat had an injury. When you took it in, was the treatment quick, or did it take a while?
No, it was right away. The cat got looked after within minutes.
Does the government run the veterinary service in Canada?
No, it doesn't.
My healthcare proposal has also been attacked by some who oppose reform as a government takeover of the entire healthcare system. Yeah.
To think that you put your medical system, an industry, in the hands of politicians and think that it's going to serve patients is presumptuous.
When politics and healthcare get so closely connected that a number of the decisions that are made are not really for the patient's best interest, they are more for political reasons.
Politicians tend to underprovide to people who are sick and over-provide to people who are healthy. Britain is an example of this, where Britain has lots of services for people who are basically healthy, and yet it skimps on the CAT scanners and the dialysis machines and the heart surgery units that would really save lives and cure diseases.
What we're talking about is that we have serious problems that we need to address. But the problem is that no politician wants to drive, because it's the third rail of Canadian politics. You touch it and you die.
I think most of the politicians have about a 4-year horizon. They can see what's happening between now and the next election, but they don't seem to be able to look beyond that.
In a typical U.S. health plan, about 4% of the members will spend more than half the money. If you're a politician and you're allocating dollars, you cannot afford to spend half of the healthcare budget on 4% of the voters. 4% who are sick, probably too sick to even go to the polls and vote for you in the next election. So the incentive will always be to take those dollars from the sick and spend it on the healthy.
Simple cases like I want a hospital built in my riding because I will get votes, even though it may not be needed.
Cancer patients usually end up dead, so there isn't a big pool of cancer patients as there is people who have had knee replacements who can walk around saying, gee, you know, knee replacements are great. Most cancer patients die within X number of years.
Are the decisions being made based upon what will get me the most votes?
Yeah, I would say so.
I would think, you know, what the public is pushing for, that's what they get. And if more people pushed to help colorectal cancer and other cancers, they then would get the funding. So it's a squeaky wheel.
Political capital is what the politicians do not want to spend. Deaths of patients, injury to patients, that doesn't bother them too much. Political capital is what they don't want to spend.
Now, I don't believe we should give the government or insurance companies more control over healthcare in America. I believe it's time to give you, the American people, more control over your own health insurance.
He answered me. He said, this morning, I had the president of your medical union on the phone. He doesn't want to let you do that. What can I do? So I told him, as a health minister, you have to act for the good of the people, not for the good of a medical union. Then I realized the scope of this state monopoly. The labor unions enjoy a monopoly of representation of the workers in this country.
And while there remains some significant details to be ironed out,
There's so many people that want to get into a hospital and get an operation done, yet you have hospitals that are closing down rooms with beds in them, that are closing down entire wings. So what do they do with it? They rent it out to film crews. How much space is there total?
Well, you can have up to 15 different rooms probably.
Mm-hmm.
And then this comes back up by that.
Mm-hmm. So this room would normally have like what, 4 patients in it maybe, or?
Potentially.
Yeah.
This one's the same as those two, with the same light exposure.
So we got another room sequence. That'll work good. Looks like a deluxe room here.
This is an east exposure.
Oh yeah. Oh, it's so that you know that we paid $300 to use the hospital. Take 1. Get sick, I don't know where you should go, but if you want to film a movie, it's a great place to do it. Bowmanville Hospital, Ontario, about 45 minutes east of Toronto.
if you like your current insurance, you will keep your current insurance. No government takeover, nobody's changing what you've got if you're happy with it.
So why didn't people buy private health insurance in Quebec?
Because it was prohibited.
If I had paid someone to do it, I would have gotten a $50,000 fine and up to 12 months in jail, and the professional that provided the service would have gotten a $200,000 fine, also with 12 months in jail.
In Canada, healthcare insurance is outlawed, so none of our clients have healthcare insurance. They pay out of their own pocket. Many of them have mortgaged their homes.
To suddenly look at your husband and realize that he's had to take a second job, put a second mortgage on our house. But I don't think it's a decision or a choice that any family member should have to make. I was fortunate that my family made it. Okay. The money part gets to me.
I can spend as much money as I want buying booze, smokes, cigarette, tobacco, liquor, gambling. I can spend all I want. But if my child is sick, I can't spend any money of my own money to go and heal my child.
And I started to do house calls. And what they did, they went to the government of Quebec and they asked them to pass a regulation to block this kind of activity I was doing.
They were punishing you for going
for saving
sick
lives.
People
who
were too sick to get in the hospital.
Exactly.
Their response was to punish you with financial penalties.
Right, right. And I felt that very unfair.
In Canada, we can get private health insurance for our pets, but we can't get it for ourselves or for our children.
Do you think that that law that banned private health insurance should now be abolished?
Most probably, the ban will have to be removed.
What rule is it that you want to change?
The monopoly of the government.
I am simply trying to challenge the law that currently makes it illegal for us to obtain private health insurance.
I did a hunger strike for 30 days.
Now, why did you do that?
To get the government to change their position. And then I studied more. I dig into the situation. I studied the law. I studied healthcare systems. I became an expert in healthcare system and in law by myself. My next move was to go to court on behalf of those patients to ask the court to invalidate those prohibitions as a violation of human rights. And that is the evidence I made before the court, which has been upheld by the Canadian Supreme Court, as you can see in the front page of this National Post at that time of the judgment.
What was the reaction in Canada?
It was like an earthquake, coast to coast.
The Canadian Supreme Court, hardly a bunch of free market radicals, handed down an opinion a year or so ago that acknowledged that Canada's socialized healthcare system forces patients to wait for care, and that not only jeopardizes their health, but it violates their human rights.
It will slow the growth of healthcare costs for our families, our businesses, and our government.
The average Canadian family pays about 45% of their income in taxes, and that is supposed to fund things including health care.
We don't have a free public health care system. You're all paying an enormous amount of it through your taxes, and frankly, we're running out of money. We're running out of the ability to fund this system properly.
The other countries disguise their costs by holding down salaries, for example, to doctors and nurses and other hospital personnel. That isn't controlling costs, it's just shifting costs from taxpayers to providers of care.
And monopolies are bad for consumers regardless of whether or not they're publicly run or privately run. So you get less variety of service, less quality of service at a higher cost.
Every $100 per capita that the Canadian government spends on health care, the waiting lists increase, not decrease, they increase by 1 week. And what is happening is there will be an announcement with great fanfare that the government has increased spending. All of the people who had completely given up hope of ever getting treatment in Canada rush to their doctors, clutching the newspaper report that there's now more funding available for people for their condition. Their doctors refer them to specialists. The specialist lists get longer by 1 week for every $100 increase per capita.
If you think health insurance is expensive now, just wait till it's free.
This will actually reduce the deficit, reduce costs, by making the system smarter, making it more efficient.
What percent approximately of the budget of Quebec is spent on healthcare?
It's over 40% of the Quebec budget.
So over 40% of the budget of the province of Quebec is spent on healthcare.
Yeah, it's too much.
What was it when you started the program?
Oh, I would say it was probably 20%, 18%. So it's been going up and it continues to go up. So this is why I'm saying that we have to make a judgment. We have to introduce user fees, introduce some form of private insurance, private services.
If you get people to be more healthy, they live longer, and that costs the government more money.
They are downside costs, yeah.
So they weren't too excited about having people live longer because that's just going to incur more costs.
Well, the economists aren't. Economically, if you can prevent visits to hospital and keep people at home, it does make sense. So there's an element of that, but it's not really the way of decreasing your costs in a healthcare system, which is the main concern of governments these days.
The budgets are exploding. Healthcare budgets are half the budgets of most provinces now, and they're steadily rising. They're meeting every year, taking drugs off the drug plans, taking tests that used to be on the drug plans off the drug plans, taking medical procedures that used to be on the Medicare plan off the Medicare plan. We've got patients doing their own tests. I mean, governments are selling to us this wonderful idea that I don't mean to be crude, but you'll take home a baggie, you'll do your stool sample for 3 days, and you'll be able to. It's nonsense. It's not what people are supposed to be doing.
And that's when individuals and small businesses will finally have the same access to the same types of insurance plans that members of Congress have for themselves.
Is there anyone else that can jump to the front of the line?
The politicians, those who are well connected, like it was the case in the Soviet Union.
People without a lot of money or people without political connections have to wait at the end of the line.
Yeah, and they will wait more. So under the socialized medicine system, the poor people suffer most.
Our ex-Prime Minister, Jean Chrétien, he was diagnosed just last month with unstable angina, and he got in and had an angiogram and a quadruple bypass in a matter of a few days.
How long did Mark have to wait?
He waited. He was on a list just for the angiogram part for 30 days, and he died within a week.
Our ministers had bad knees, they'd have a replacement done within a week. Right. Other people are suffering for years.
Today, the Prime Minister responded to accusation he uses private medical care. His denial couldn't have been more forceful, but trying to score points in healthcare is still the biggest game in Ottawa.
It's come to this already. Paul Martin defending personal visits to his family doctor.
He basically gave me medical advice for which I paid using my Medicare card.
Here's what the Conservatives were talking about. The offices of Martin's longtime doctor, where regular services are available to everyone, but for a premium, some get executive treatment. And, suggested news reports, Martin himself took advantage of that, the kind of thing he's publicly all but denounced.
These reforms won't give the government more control over your health care. They certainly won't give the insurance companies more control over your health care. These reforms give you more control over your health care. And that's only the beginning.
We've had an awful lot of propaganda about our system, and it's heavy, very heavy, and everybody in power agrees with it.
I think I would be opposed to someone with the same condition as me spending their own money to get a treatment, because it's important that everybody in a system which is social medicine like ours, that everybody has access to the same treatments. And I think it would be unfair for someone to be able to access treatments who had more money than I do, for instance.
But you went to Germany. You spent your own money going to Germany and to Buffalo.
Yeah, it is a bit hypocritical, isn't it?
The thing our politicians will not do is accept responsibility. They pass the buck, they blame other people, they try and turn Canadians against each other on the public-private issue. They mislead us, they lie to us. I mean, they openly lie to us. All governments, Conservative, provincial, NDP, they lie.
We hear horror stories about the United States system.
What people see as one of the great anchors of Canadian identity is our much vaunted but underfunded health system.
So it's been sort of a taboo to even talk about adjusting the Canadian health system.
To a large extent, yes. It has become a sacred cow to a certain extent, and people did not dare to touch it.
It really makes me angry that we've been heavily propagandized here that we have a very fine system, and it hurts to realize that I've been suckered into believing that.
Companies now are selling their services to link up ill Canadians so they can find medical services and procedures and programs in other countries like in the United States or in India or Pakistan or China.
Our mission is to help Canadians who are on interminably long medical waiting lists, whether for diagnostic imaging or whether for surgery.
They phoned Northtown Images in Buffalo and arranged for an MRI the following day.
I contacted the Mayo Clinic in Scottsdale, Arizona.
I was in surgery in Germany to get the double disc replacement therapy I needed.
He referred us to the cancer center in Italy, and we went there.
We got our consultation within a week down in Bellingham, Washington.
Canadian politicians always speak out against private health care. But guess who came to America to get private care when their life was on the line? Prime Minister Jean Chrétien, Quebec Premier Robert Bourassa, Newfoundland Premier Danny Williams, as well as members of Parliament like Belinda Stronach.
My sincere hope is you keep your system in the U.S. And continue helping our Canadians who are unable to get care in our existing government monopolistic system.
Should America adopt the Canadian healthcare system?
Definitely no. American patients are going to suffer, and some of them are going to die.
Health insurance reform becomes law in the United States of America.
It's clear where Obamacare will lead us, and we need to go the exact opposite direction.
Thank you.